So we'll go ahead and get started. I want to thank everybody for joining me. I do appreciate it. For those of you who have not joined me in this format before, I am Brian Sanderoff. I'm a traditionally trained pharmacist that used to own two pharmacies in downtown Baltimore. And after a while of being in my store, I realized that I really wasn't helping people the way I wanted to. And so I sort of switched tracks. I have hosted and produced a radio show about alternative medicine for better than 20 years. And I have a wellness center and a holistic pharmacy in a suburb of Baltimore, Maryland. A big part of the work that I do and that we do in the center is to act as a resource for people. And so I really do encourage you to get in touch with me. And you can do that right through the website by either emailing me or by calling us on our toll-free line and asking your questions and making sure that you're getting good advice for your issues. In this sort of format, the information that I'm presenting is absolutely correct, and by nature, it has to be general, and sometimes we need help in applying that information to us as an individual. And so I do encourage you to go ahead and ask those questions if you have them. So today we're going to be talking about PCOS, which stands for Polycystic Ovary Syndrome. Now on there it says a modern epidemic, and that is very true. The numbers are staggering as for how many people actually suffer from it. And then underneath it says, but is it really a disease? And I want to start off by saying that I'm sensitive to two things right now. One is that I'm a male talking about a female problem. And please know that I have experience with this with patients, and I have a keen understanding and amount of empathy for women that are going through this issue. Please do not consider that because I'm a guy, I can't understand what it feels like or to go through having this sort of issue. And then number two, please do not be insulted if you do have this by that statement, but is it really a disease? Because that's not about you as an individual. That's more a statement about medicine and how we look at issues in our body. And hopefully you'll come to understand that as we go through this presentation. So let's go ahead and get started. So PCOS stands for Polycystic Ovary Syndrome. And here are some of the numbers. So we can see symptoms in up to 10% of women that are in childbearing ages, and that's between 14 and 45. And actually only less than half are actually diagnosed with this issue, if diagnosis is possible. It is the most frequent endocrine problem in women of childbearing years. 40% of women with diabetes or insulin resistance actually have PCOS, and there is an extremely strong genetic component to this. And so if mom has PCOS, there is a 50% chance that daughters will also have it. Those are pretty staggering numbers. I want to go quickly through the symptoms, and this is like the part of the presentation that is like the regular medicine and how medicine looks at this. And so, obviously there's menstrual disorders, and they can show up as irregular periods or no periods or other PMS sort of symptoms. There's what we call subfertility or infertility, meaning that you can't get pregnant or you have difficulties getting pregnant. We see elevated levels of masculinizing hormones. So the one we think about most is testosterone. They're called androgens. And so you can see acne, you can see hair growth where you don't want it, your body, your face. You can see hair loss where you don't want to lose hair, which is on your head. And you can actually have frequent menstrual periods. Actually can be just the opposite of, not having them. And then metabolic syndrome or insulin resistance. And this can result in weight gain, especially around the middle, difficulty losing weight, skin tags, darkened patches on the skin, elevated cholesterol, triglycerides, and blood pressure. All can go along with this syndrome, PCOS. Diagnosis. And let me just point out again, because I see some new people coming in. Again, if you have questions as I'm going through this presentation, please just type it right in. On your control panel, you have a question box, and if you type it in there, it shows up on my screen as we're doing this. I'll be able to address your question and or make sure that I'm giving you the information that you're interested in. So here's something that's interesting about diagnosis. And so not all women with PCOS actually have polycystic ovaries, and not all women with ovarian cysts have PCOS. And this is where we get into a difficulty in understanding this quote unquote disease or syndrome and how to determine that somebody has it or doesn't. So the first sort of diagnosis criteria came out of NIH in 1990, and what they said is that you needed to have all three of these. You needed to be able to say yes to all three of these things. Number one, irregular ovulation, signs of androgen excess, and so that's that testosterone thing, and that would be in women, hair growth on your face, acne, that kind of stuff, and exclusion for other reasons for having polycystic ovaries. And so you can have other reasons like hypothyroidism, Cushing's disease, various other pituitary or adrenal, disorders. You can actually even have an androgen-producing tumor, cancerous or not. So you have to rule out that the polycystic ovary issue isn't from some other reason. In 2003, there was a big meeting in Rotterdam, and they changed the criteria a little bit, and they said you can have two of these three to be diagnosed with PCOS. And so either irregular or no ovulation, excess androgen activity, or polycystic ovaries by ultrasound. So they actually see the cysts on your ovaries. And again, just two out of three of those things. And so if you've got some irregular periods and you've got cysts on your ovaries, then you can be diagnosed with PCOS. You can start to see how difficult it is to really diagnose this as a disease based on these criteria, because there could be a lot of reasons why somebody can have an irregular period that may not have to do with PCOS at all. In 2006, they sort of tightened things up a little bit, and this convention that was called the Androgen Excess PCOS Society got together and said, no, it needs to be all three of these things. And so this actually tightened up the diagnosis a little bit, and I say made it harder to get diagnosed, but sort of brought down the population that would be officially diagnosed with PCOS, and that is excess androgen activity. So again, acne, hair growth, hair loss on the head. Irregular or no ovulation, and or seeing the cysts on an ultrasound, and then exclusion for other reasons for having PCO, polycystic ovaries. So that's sort of how you diagnose it in medicine. What's the cause? When we talk about a disease, we want to know what the cause is. Well, unfortunately, according to medicine, the cause is unknown. And this is where we really sort of scratch our heads and say, well, wait a second, is this really a disease instead of just sort of a conglomeration of symptoms that are happening to a susceptible population? And that's really what's going on with PCOS. And that's usually the case when you see syndrome at the end of a quote unquote disease in medicine. It usually means that, well, we don't know what the cause is. There's a bunch of symptoms, and if you have a certain number of those symptoms, we're going to say you're part of that syndrome. Irritable bowel syndrome would be another example of that. What's the treatment? Well, it says management there, because really treatment in medicine is more like just managing the symptoms, and it really depends upon the symptoms that a particular woman is having and what her goals are as far as that goes. And so oftentimes prescription medicines can be used, and you women in the audience now today that have PCOS and have been treated for it are probably shaking your head saying, yeah, that's what the doctor did or wanted to do. You can use prescription medicines for each of these sort of individual management areas. Sometimes you can see some effectiveness. Oftentimes that effectiveness comes with the price of side effects. And usually, if it is effective, it's initially effective, and then the effectiveness starts to go away as time goes on. And so there's insulin resistance, and this is, the medicine that would be prescribed for this are usually oral medicines that we would use in diabetes, like metformin to help control sugar. It may also help lower testosterone levels and assist in bringing about ovulation. Fertility could be an issue as well. Regulation of the menstrual cycle, and here the most common thing that's used are birth control pills. They regulate the cycle. They may also help decrease in acne and testosterone levels, and in fact, you may know this just from watching primetime television, because when you see commercials for birth control pills, oftentimes they're combining that commercial with the fact that this will help treat your acne. And then the acne or hair growth things. And so there's a prescription medicine that's called Adaptone. It's actually a diuretic, and it also has been shown to lower testosterone levels in the body. The problem with this is that none of these treatments are really getting down to the actual cause of PCOS, and that's because in medicine we don't understand the quote-unquote cause. Well, I'm going to hip you to that in a couple seconds. All we're doing with medicine, with these prescription medicines, is really turning down the volume on what the body's saying. And if you guys have listened to me talk before, you know that I don't like to turn down the volume. I like to understand what's going on in the body. And the analogy I always use with this is that if you're driving around in your car and you see that little oil light on your dashboard illuminate, you have a couple choices. You can take it to the mechanic and find out what's wrong and get it fixed. Or if you want, just take a piece of black tape and put it over the light and you don't see it anymore. All of the treatments that medicine has for you for this disease, and this is the case with practically every chronic disease known to medicine, all we're doing is turning down the volume. We're not really fixing problems here. And so today we're going to talk about fixing problems. So I have a couple questions for you. And these questions, again, are designed to make you raise your eyebrows and think about things in a different way, as opposed to, insult you or challenge you. So number one, what's the difference between a disease and a syndrome? Something to think about. And again, I sort of mentioned that when we have syndrome after after something in medicine, it usually means that we don't know what's causing it. There's no specific disease. What it really is a set of symptoms that are showing up in a susceptible population, and that is the case with PCOS as well. And then second question for you, which came first, the chicken or the egg? And after I looked at this in review, I realized that I was maybe making a little joke here and not intending to, as far as ovulation and eggs. But the reason I asked this question is because, is it the susceptibility and then circumstances that cause the problem, or is it circumstances that cause the susceptibility? I'm not sure that we have an answer for that with PCOS, but you'll understand a little bit more as I go through the presentation. And I'm not going to apologize, but I'm going to warn you that for you to understand what's going on with this syndrome in your body, you have to have a little biochemistry. And so this gets a little bit complex. I've tried to make it as simple as possible. I do fully recognize that I am a biochemistry nerd and I enjoy this stuff, maybe a little bit more than you, but it is really important to understand the basis of this so that you can understand what's going wrong in the body in relation to PCOS. So here we go. The hypothalamus is a regulatory center within the brain, and it releases a hormone which is called gonadotropin releasing hormone. We call it GnRH. The pituitary is also in the brain, and the gonadotropin releasing hormone instructs the release of two other hormones from the pituitary. One of them is called follicle stimulating hormone, or FSH, and the other is called luteinizing hormone, or LH. These hormones then direct the ovary to start making estrogen and to stimulate the maturation of eggs. And this happens in about 120 follicles within the ovary. Some androgens, and these are the male hormones, like testosterone, are also made by the ovaries. All right? The first follicle that ovulates, releasing its egg into the fallopian tube to go to the uterus, turns into what we call the corpus luteum. And you can think of that as sort of a progesterone making factory, because when an egg is released, progesterone then plays a role with preparing the body to implant a fertilized egg so that a baby can grow. So this progesterone making factory raises progesterone concentrations to 200 to 300 times that of estrogen. This surge in progesterone causes the lining of the uterus to go into its ripening phase, getting ready for the implantation of a fertilized egg. It also turns off any further ovulation by either one of the ovaries. So when this happens, it then says, okay, we've got our egg, stop doing what you were doing. If fertilization doesn't occur, then the ovary stops elevating production of both estrogen and progesterone. And then this causes the uterus to shed its blood-rich lining, and this is what we know as the menstrual cycle. This is menstruation. And in response to lower hormones, the hypothalamus releases gonadotropin-releasing hormone, and the cycle starts all over again. And so this is what happens underneath the surface with certain glands and organs in your body as you go through your menstrual cycle. This is what is supposed to happen. This is what nature intended for us. But I have a question for you, and that is, what happens if something goes wrong? So hypothalamus does its job. It releases the gonadotropin releasing hormone, which tells the pituitary to release the follicle stimulating hormone and luteinizing hormone, which then tells the ovaries to make estrogen and start the process of the maturation of eggs. Ideally, the follicle is supposed to release the egg. Well, what happens if the follicle doesn't release the egg? And the reason I go over all of this is because this is exactly what's happening with PCOS. When this happens and the follicle doesn't release the egg for whatever reason, and we'll talk about those reasons in a little bit, the follicle then becomes a cyst instead of a corpus luteum. And the progesterone surge never happens. So this really causes the hypothalamus to say, wait a second, something's not right there. And the hypothalamus continues to try to stimulate the ovary through the release of hormones to the pituitary and then to the ovary to make more estrogen and more androgens, which again are the male hormones. And then what happens is more follicles are actually stimulated towards ovulation. And if they can't produce mature eggs and release them, then more cysts are formed. Now you're getting the understanding of the polycystic part of it, more than one cyst. And the menstrual cycle ends up being dominated by estrogen and testosterone production. In essence, this is exactly what's going on with PCOS underneath the surface. So this really begs the question, why or what causes dysfunction in the follicles? What causes this whole process to happen in one person versus another? It's important to understand this. So number one is genetic susceptibility. And again, in the beginning, I told you that if mom has PCOS, 50% of her daughters are going to have PCOS. That's really important to understand, that there is a genetic proponent to this. So, sorry, Sarah's asking a question. She says, so if you have PCOS, you are low in progesterone and estrogen dominant. That is correct. There are lots of reasons why that happens, and we're going to talk about that. Estrogen dominance is a huge problem that leads to all sorts of menstrual issues, including sort of the end of the spectrum, which is this PCOS. You could have bad PMS symptoms, not officially PCOS, just bad PMS from estrogen dominance as well. All right, so understand that there is an important genetic piece to this. And in other words, there are some women who have genetic tendency towards these issues. And because these things that I'm about to mention will not affect every woman the same way, this is part of the difficulty in understanding and treating PCOS, especially from a medical perspective, because medicine wants to treat every woman the same and look at PCOS as a disease like diabetes, and so find the same answer for each woman. And that answer does not exist. And furthermore, trying to prove what I'm about to uncover for you is also very difficult, because not every woman will get symptoms from the issues in the areas that I'm about to discuss with you. So please understand that for some women, more and more these days though, it is really the perfect storm of genetic susceptibility and the factors that I'm about to mention that cause PCOS to happen. Factor number one, estrogen-like compounds in the environment. We call them xenoestrogens with an X, or xenobiotics sometimes. And what they are is estrogen-like compounds that we're all exposed to in society today. I'm talking about plastics, preservatives, colorings, flavorings, all sorts of chemical compounds that resemble estrogen, and they have the potential to act like estrogen in the body. A little story that I like to share with somebody that is so susceptible to these things is actually my sister, Annie. Annie is 65 years old now, and she will get menopausal symptoms if she drinks water out of a plastic bottle. She's that sensitive to these estrogen-like compounds from the environment. And, she could just drink water out of one bottle and she'll start to get symptoms, and then those symptoms will go away unless she continues to drink water out of a plastic bottle. So here's the really sort of interesting and maybe scary part. And I'm going to go slow because I think it's important to understand and to wholly grasp the significance here. All right. So when the female embryo develops in the womb, it's estimated that some 500 to 800,000 follicles are created. Each follicle encloses an immature egg, and these are the eggs that will be released during the childbearing years for that woman. And again, remember, with each cycle, it's about 120 follicles that are activated. Right? Studies have shown that the formation of these ovarian follicles when the embryo is growing into a baby in mom's uterus is intensely sensitive to the toxicity of these xenoestrogens from the environment. So mom gets exposed to these chemicals while pregnant. Nothing apparent happens to mom, but the female baby that she is carrying may well be developing ovarian follicles that are more likely to be dysfunctional later in life, unable to complete ovulation, which ultimately leads to, cysts. And also, those follicles do not have the ability to manufacture sufficient amounts of progesterone. And the interesting thing is that this problem will never show up until after puberty, because you don't see those problems start to happen until menstruation happens. So this is one huge factor from the outside world. Number two, there are lifestyle issues like stress and exercise and diet. So this is interesting. And again, I have webinars that I've done in the past on each one of these things individually. So if you want to get more information, go to the archive on our website and you can see a whole 45 or 50 minutes about stress, about diet, and the things that I'm about to talk about. But here's the Reader's Digest condensed version. Stress causes the release of cortisol. This is the hormone of the stress. And do you know what the body uses to make cortisol? It uses progesterone. Progesterone is the root material to create cortisol. So when we're under stress and creating cortisol, we're actually lowering our effective progesterone levels. And so you can have estrogen dominance even without having excess estrogens in your body. You could actually have estrogen dominance because of low progesterone levels. Exercise, really important, because regular exercise helps the body use sugar more efficiently and keep insulin levels under control. And I'm going to talk about more about that in a second. I'm going to talk more about the diet and the importance of this. And then the last factor from the outside world that I want to talk about is pharmaceuticals, because here's an example of this. Birth control pills. What do they do? Why do you take them? Because they interfere or shut down the normal functioning of the ovaries so that you won't get pregnant. Well, there are some susceptible women who are never able to recover normal ovary function after stopping the pill. So it may be that in your teens or your late teens or your early 20s, you start taking a birth control pill for birth control reasons, and then you end up getting married and you're ready to start a family, and you go off the pills and you have a hard time getting pregnant, or symptoms of PCOS start to show up. And this is because in some susceptible women, getting that function back to the ovaries just never happens properly. There's a whole host of prescription medicines that also alter the function of the limbic brain, like antidepressants. And that's including the hypothalamus, which can also affect normal menstrual function. Again, going back to that screen that showed how the hypothalamus starts this whole process off. How am I doing so far? Questions? Doing okay? Don't forget, type it in if you like. Okay, another question from Sarah. So what would you suggest to women who want to prevent pregnancy? That's a really good question, and it's a difficult one to answer because you know, when I've been through this with patients, you sort of have to ask the important question: what are the dread effects of an unwanted pregnancy? Obviously, there are lots of other methods of birth control other than using hormones from the outside world, and so condom and spermicides, or condom and other methods are really the body friendliest way to prevent pregnancy. If used appropriately, they should also be as effective as the birth control pill. The reason that women have gravitated, I believe, to the birth control pill is one, because it's simple and it's effective. It's the most effective thing out there. Sarah asked, what about a low dose hormone pill? Less potential from the low dose, birth control pills to cause this, I'm going to say irreversible, but hard to reverse alteration in ovary function, but still potential there. And Sarah's also saying, I will never go back on them, but would wonder for my daughter when I have one. Yeah. Yep, I understand completely, and it really is. It's a function of our modern society and this falsehood that we've all been sold on. And I talk a lot about mother culture and how mother culture is always whispering in our ear these silly little things that we don't even question anymore. And one of those things is this idea of better living through modern chemistry. And we really have to start to question that. And this is sort of an example of that, and how putting in hormones from the outside world because we have one goal may cause problems in other areas. Gianna's asking a question: could ADHD pharmaceuticals affect your body's ability to produce hormonal balance? Yes, absolutely. There's no question. Now, sometimes that can be complicated. It's not necessarily that they have their effect on a particular gland in the body, but they play a role with stress, how the body responds to stress, which then in turn can affect adrenal function or how the body works. All good questions. Thanks, guys. I really appreciate that. So let's talk more about the diet, because it's really important to understand this. The thing that we have to get rid of are high glycemic index foods. The glycemic index of a food is how its property of how quickly it raises blood sugar. It's not that it has sugar in it, it's how quickly it causes a spike in the blood sugar. And the problem is that when you have a high glycemic food, it leads to elevated insulin levels, and that is the enemy here. It is those elevated insulin levels that play such an important role in interfering with the release of the egg from the follicle, which then causes it to become a cyst. It's the insulin levels. And so when you eat a high glycemic food, your bloodstream gets inundated with sugar, and the body's response is to say, oh, I don't know where all that sugar is coming from, but we have to overproduce insulin to take care of all of the sugar. Genetically speaking, we were not geared to have grains as a staple in our diet. And I would refer you to the webinar that I did, I think 2 months ago, maybe in December, talking about getting off of grains completely and why it's so important. And we'll go into this issue in much more detail. But understand that insulin, as well as clearing sugar and doing all the things that we know it's supposed to do, it actually stimulates androgen receptors on the outside of ovaries. Now, androgens, again, are the male hormones, like testosterone, and that's what we're trying to avoid here with PCOS. Excuse me. So, the androgen receptors on the outside of the ovaries, when stimulated, will cause typical PCOS symptoms of excess body hair, thinning and hair loss on the head, acne. Androgens also play a role in blocking the release of eggs from the follicles, leading to more cysts. So again, we have to not do things that cause insulin to rise. And then we end up with insulin resistance. Now, this is kind of interesting because when we have insulin resistance, meaning that we release sugar into the bloodstream, the body releases insulin, pancreas does, and then insulin's supposed to go around and knock on a cell and say, hey, here's some sugar, take it in, use it for energy, or store it for energy for tomorrow. The best form of storage is called glycogen, and that happens in the liver and the muscles. Once that storage capacity is filled, then the body will take that sugar and store it for energy tomorrow. We have another word for that. That's called fat. So when we get insulin resistance, insulin comes and knocks on the cells in the liver and the muscles, and the cells say, we don't hear that knock. And so the body says, all right, well, we're going to save this for tomorrow, and it increases fat. And fat cells are estrogen-producing cells, which makes this problem of estrogen dominance that much worse, which then leads to all of the dysfunction in the ovaries that leads to the PCOS. And again, there are some commonalities between PCOS and insulin resistance and overweight. And oftentimes women that have PCOS have a hard time losing weight. They gain weight, especially around the middle, and they have insulin resistance. And that's where the egg and chicken thing comes in, because is it the insulin resistance that leads to the PCOS, or is it the PCOS that leads to the insulin? And it's more likely about the diet. Now, when we think about the young women in our society and their diets, when they're teenagers, we've built a whole army of people, men and women, boys and girls, that rely on fast foods, that rely on grain-based foods, that rely on foods that are high glycemic, that cause this problem in the beginning. And so we have to reverse the insulin resistance. The way to do that is to get those grains out of your diet. You must clean up the diet. And that means that even if you don't have problems with this, but especially if you do have PCOS, you have got to get the grains out of your diet completely. Every grain, just take it out. Now, this is not a lifetime sentence. I'm about helping people have a different experience and then deciding what they want to do with that knowledge. And so if me telling you that having grains in your diet is related to your hormonal imbalance and potentially your PCOS, and you say, I didn't know that, and for 3 months you get the grains out of your diet completely, and you take some of the other steps that I'm going to talk about in a second, but you get this grains out of your diet completely for 3 months, and 3 months down the road, you take a look in the mirror and you see that you've lost some weight, and you've lost some fat, and you jump on the scale and you put on your clothes and you notice they don't fit the same. And you also notice that your hormonal imbalance issues are better, that maybe you've seen some changes in your period, that your energy's better and your sleep's better and all sorts of other things have changed. If you then say, you know what, that's interesting, but pizza's more important to me, I'd honor that. But at least you would fully understand that what you have is an issue related to the choices that you're making, not that you have a metformin or an aldactone deficiency. You understand what I mean by that? So number one, you got to clean up the diet. Number two, you have to get regular moderate exercise. And I put the moderate on there because, if you go crazy with your exercise, one of the results of that can be actually increasing your testosterone levels. And we want to sort of moderate that. And so the purpose of this exercise, and I will emphasize regular, you have to do it every day, is that's how you reverse insulin resistance. That's how you use up your fat stores. That's how you lower your manufacturing of estrogen in your body. And it has to be regular. It has to happen all the time. Number three, you have to address stress and your adrenal glands. And that's because, again, when you're under stress and you're making cortisol, you are using progesterone to do that. And that, in effect, lowers your progesterone level, which makes all of this worse. And stress and attention to your adrenals is key to reversing these symptoms and or dealing with PCOS. Now, I don't like to say that this can cure you of PCOS because I don't think you have anything to be cured of. It's not a disease. It's a set of symptoms. It's a way that your body is talking to you, telling you that something is out of balance, and you have the ability to get that back into balance by, undertaking these steps. I also want to point out, and I see patients in my office here, and I had a patient yesterday that this sort of came up with as well, because she's under stress and it's her boss. And I can't tell you how many people I have sat down with who've told me it's their spouse or their boss or their parents or their kids, and then they go out and get new spouses and bosses and parents and kids, and they have the same issues, because it's not what's happening, it's how you're reacting to that. And that's the part that you can control. And I'm going to talk about supplements in a little bit that go over, that will help deal with the adrenal part of this as well. Caitlin's got a question for me. What is your definition of a disease? That's coming from Virginia. I don't know. I don't know how to answer that, because I know what the medical definition is, and a disease when there's a dysfunction in the body. But when we use it medically, we think of a disease as something that we can cure. And when it comes to every one of the quote unquote chronic diseases or the diseases of aging that we deal with in our society today, I don't think any of them are diseases. I think they're all just very convoluted ways that the body is trying to say, hey, pay attention. Something's not right. And that's the basis of the work that I do. And Caitlin says, I'm funny today. Thanks, Caitlin. Appreciate that. All right, so let's get into the supplements a little bit, because these are really important to help. Oh, Caitlin says, no, that was Virginia saying I was funny also. Okay, gotcha. These are the supplements that I think are really helpful in helping to get the body to function in a different way. I'm not going to say this is going to cure any disease, because, again, I've had that disease discussion. Number one, healthy fats. There is nothing more important in your diet to help cells communicate with each other. And when we talk about a gland and the release of a hormone and its effect on another gland and the release of another hormone and around, healthy fats play a huge role in those communications being as uninterrupted as possible. And healthy fats play an especially important role in your body handling sugar appropriately and reversing insulin resistance. Now, for the last 30 or 40 years, and again, I did a whole webinar on healthy fats, and you can go to it and get a whole, hour about everything you ever wanted to know about fats and why they're so important. I'm going to give you the Reader's Digest condensed version right now. For the last 30 or 40 years, we've been told by medicine that we should be on a low-fat diet because fat is the enemy when it comes to cardiovascular disease. Nothing could be further from the truth. Sugar is the cause of cardiovascular disease. It also happens to be the cause of every other chronic disease of aging, including PCOS. It's not really the sugar, but the body's response to the too much sugar or sugars that hit the bloodstream too quickly. So we shouldn't be on a low-fat diet. We should be on a healthy fat diet. And I would encourage everybody, including anyone that suffers from PCOS, to be on an aggressive dosage of fish oil. Now, usually about now, I've got some vegetarian who says, wait a second, I won't do fish oil because I'm vegetarian. And I can tell you that the vegetarian lifestyle, which is oftentimes grain-based, is actually more difficult and causative to problems like PCOS. And that's because generally they're grain-based and they're high glycemic, and two, it's hard to get the healthy fats. The vegetable sources of healthy fats like flax, it's not the fats that the body uses, and the body has to convert the ALA that's in flax oil into EPA and DHA, which is the fats that the body uses. And many people lack the ability to do that conversion. That's why we have this problem in the first place. So number one, healthy fats. Number two, adaptogens. That's the term that we use for herbs or nutrients that help soothe, comfort, and regenerate the adrenals. They help you adapt to the environment in a different way. So in essence, adaptogens can calm your adrenal response to stress. And for folks that have PCOS, what that means is less making of cortisol, which means less stealing of progesterone, which will help support the follicles releasing the egg so that they don't turn into cysts. That's simple, really. So there's a bunch of herbs that you've heard of, like ginseng or licorice, that are adaptogens, and maybe other ones that you've never heard of before, like ashwagandha or schizandra or arctic root, a whole bunch of different ones. And there's different formulas that we use. And I can tell you that patients that I've had, who I've had the opportunity to help educate about PCOS, that have taken these supplements, have fared very, very well. It's not necessarily the kind of thing that turns around overnight. It's not the kind of thing where you take an adaptogen formula for a week and your PCOS symptoms go away. It doesn't happen that way. You got to go through some cycles to get your body working the way it's supposed to. So you can think of this sort of regimen. If it were me, I would think of it as sort of a 6-month experiment. So Sarah's asking a question. So what adaptogen formula do you recommend? It depends on the individual, and this is where a little help can come in. But again, I did a whole webinar on stress that goes over it in much more detail. But generally speaking, people can be over responders or under responders to stress. So an over responder would be someone that when they're under stress, they get busy, they get nervous, they get anxious, their mind won't quiet down, they can't sleep because they're thinking about yesterday or tomorrow. Those sort of people would use certain adaptogens which are calming. That's not a person that I'd want to give ginseng to, because that would just ramp them up more. There are other people who, when they respond to stress, they get quiet. They just want to get into a room, get into bed, pull the covers over their head, and avoid the world. They get depressed. They get low in energy. And for them, there are a different set of herbs or nutrients that we would use. So there are different formulas that we use for different people. Two of my favorite formulas for the under responders that are just low in energy, they can't get out of bed, they can't get moving, they can't even respond to stress anymore. We use a product that's called Power Adapt. For those that are over responders and just get nervous and anxious, there's one that's called Cortisol Calm. And those are two different formulas that we use with good success. Boy, 45 minutes has gone by fast. All right, I also want to talk about progesterone cream. Now, there are people that are walking around with the idea that using progesterone increases your risk of all sorts of problems. And this comes from the prescription medicine Provera, or the combination of Provera and Premarin, because studies have shown that using that has caused some problems, including susceptibilities to cancers and some other issues that none of us want. However, you have to understand that Provera was not bioidentical progesterone. It was a chemical progesterone analog that looked like progesterone but didn't necessarily act completely like progesterone in the body. When you're using bioidentical progesterone cream, which by the way is available over the counter, what you're doing is adding back to your body the progesterone that the body is not able to make, either because that follicle is not releasing the egg, or because progesterone levels are low because of stress and because of insulin resistance and having those grains in your diet. Now, you can add progesterone from the outside world in the form of a cream, which gets added on days 14 through 28 of your cycle. And I've had a lot of good experience in helping women get their cycles back under control by using progesterone, over-the-counter progesterone cream. I also want to emphasize that progesterone cream is not wild yam cream. There's an ingredient in wild yam which is called dioscorea. This is thought to lead to progesterone in the body. And the reason it's thought is because in the pharmaceutical world, you actually use wild yam in the laboratory to make progesterone. It's an enzymatic process that has 6 or 7 or 8 different steps. And we make the assumption that if we do this in the lab, well, the body can do that same thing, and that's not the case. And so you actually want to see progesterone USP on the label, not just wild yam. Now, many progesterone products also have wild yam in it, but it has to have actual progesterone USP. And there's a specific way to use it. I would say it's not necessarily for everybody to do, and so I would encourage you to get some individual advice before you just buy a progesterone cream and start using it. The last nutrient I want to talk about is iodine, because iodine is woefully missing from our diet. I did a whole webinar about iodine. I've written an article on our website about iodine. I would encourage you to understand it. There are lots of reasons why we don't have enough iodine in our diet. It's not important for this discussion. What is important is how vital iodine is for use by the ovaries to function properly. And I can tell you that the usual regimen that I put a PCOS patient on is a high dose of iodine, an adaptogen formula, healthy fats, and then we give it a few months. And many times we see turnarounds within those few months. If not, then we'll start considering progesterone cream in addition to that. And that's my story. That's the PCOS story. And I hope that has been fairly clear in understanding understanding it. As I was going over my notes and creating the PowerPoint presentation for this today, I was really scratching my head and saying this is going to be a challenge in sort of bringing it down to the level of understanding without having years of biochemistry and in boring labs and lecture halls. And so I hope I did a pretty good job with that. If you have any other questions, now's a good time to sort of type them in. I want to encourage people again who are listening now live or who are listening to the recording of this that I am available to help with applying this information to you as an individual. Please do not hesitate to get in touch with me. I also want to make sure I remember to mention that on our archives, we have all sorts of recordings of these webinars. This one will be on the archive within a week, and but all sorts of other issues, including cholesterol and osteoporosis and having a good night's sleep and weight loss and stress and many of the other things I mentioned as well. Sarah's saying, sorry for all the questions. What do you think about symptoms disappearing after having a baby? Okay, so first of all, don't you ever be sorry about asking me questions. That's what I'm here for, and that's why I want to make sure that you're asking those questions. And so it is an interesting phenomenon that hormonal things can change in a woman before and after having a baby. And it can go both ways. I know women who had never a hormonal issue in their life, then they have babies, and then they start having all sorts of irregular periods and headaches when they're having their periods or whatever. And I've seen the other thing happen as well. And I'm not completely sure why, and I'm sure the answer is very, very complicated. It has to do with functioning of the body. It has to do with life and lifestyle. For some women, having a baby is like the miracle that I think nature intended it to be, and it actually changes their outlook on life and how they relate to the world. And with some women, the opposite can happen, where it becomes much more stressful. And there's lots of reasons why that happens, including how they were brought up as an individual and their relationship with their moms and blah, 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 and all that stuff that we should be talking to our counselors about. So I think that's probably the reason why that happens. So Sarah's asking, will I be less likely to have troubles conceiving again since I already had a healthy baby? I would expect, Sarah, knowing you personally, I would expect that is the case, and that you'll find that it's easier the second time around. There's less pressure. You're not worrying about it as much because of the experience that you've already had, and willing to bet that happens. It's very interesting. I've seen this, and my best friend growing up was a result of this as well, that oftentimes parents try to get pregnant, they can't, they adopt, and the second they adopt, then they get pregnant. And that's because sort of like the pressure's off, and that has to do with progesterone and stress and cortisol and that whole connection there. So let's see. Kim is saying, thank you so much. I have lost an ovary to this and want to know if I am having night sweats. Can this be caused by low progesterone? Absolutely. Progesterone is a tool that we use for menopause and menopausal symptoms, premenopausal, and like I said, PMS and PCOS and all sorts of other things as well. And a side note, I'm 35. Again, from Kim, she says, I'm 35, seems early for the change. Yes, it does. And there are many of us there are many women that are walking around with what I consider a premature menopause, which is caused by society and how we live in society today. So I would agree that now there's a genetic component to that as well, but there are many people who are walking around with what I would call a Western-induced menopause. And Sarah says, thanks. Informative. I appreciate that, and I'm going to go on and sign off now. Everybody, thank you so much. Please share this information with folks, and I hope to see you all again in this forum next month. Everybody, take care.